The origin of healthcare finance. The origin of healthcare finance can be traced back to the establishment of organized healthcare systems and the need to allocate resources to provide medical services. Throughout history, various models and approaches to healthcare financing have evolved, reflecting the cultural, social, and economic contexts of different societies. Ancient civilizations had rudimentary healthcare systems, often based on religious or tribal practices. In these early societies, healthcare was typically provided by healers, priests, or community members. However, there was usually no formal financial system in place to support these healthcare services. As societies advanced and became more complex, healthcare began to require more substantial resources. One of the earliest documented systems of healthcare finance emerged in ancient Egypt around 1500 BCE. The pharaohs created a system called Hekkai Khasut, or physicians of the palace. These physicians were responsible for providing healthcare services to the royal family and other elite members of society. The pharaohs allocated resources and finances to support the healthcare needs of their ruling class. In ancient Greece, around the 5th century BCE, the city-state of Athens implemented a system known as obolis. Under this system, a small fee was collected from citizens, which funded the provision of healthcare services. This marked an early example of individuals contributing financially to support healthcare expenses collectively. During the Roman Empire, public health and healthcare became matters of state concern. Emperor Augustus established the valetudinaria, which were military hospitals that provided care for soldiers. These hospitals were financed through public funds and marked an early attempt at state-funded healthcare. Throughout the Middle Ages and Renaissance, healthcare financing was often tied to religious institutions. Churches and monasteries provided medical care to the sick, and funding came from donations, endowments, and religious tithes. The Catholic Church played a significant role in providing healthcare during this period. The development of modern healthcare finance began to take shape during the 19th and 20th centuries. The Industrial Revolution brought about significant social and economic changes, including the rise of urbanization and industrialization. These changes led to the establishment of public hospitals, private healthcare institutions, and the emergence of health insurance systems. In the late 19th century, industrialized countries like Germany and Britain introduced compulsory health insurance schemes. These systems were designed to protect workers and provide them with affordable access to healthcare services. The concept of social health insurance, where contributions were made by both employees and employers, became a foundational model for healthcare finance. In the United States, healthcare financing developed differently. The early 20th century saw the rise of private health insurance plans, primarily driven by employers who sought to provide healthcare benefits to their workers. This eventually led to the establishment of government-sponsored programs like Medicare and Medicaid in the mid-1960s, which aimed to provide healthcare coverage for elderly and low-income populations. Since then, healthcare finance has continued to evolve, influenced by factors such as advances in medical technology, changing demographics, and shifting societal expectations. Governments, private insurers, and individuals all play roles in financing healthcare, with various models and systems implemented worldwide to ensure access to medical services while managing costs. Overall, the origin of healthcare finance can be traced back to ancient civilizations, but it has undergone significant transformations over time, reflecting the changing needs and priorities of societies. Thanks for watching. Don't forget to like, comment and subscribe for more such videos.